Good afternoon. My name is Cody Hillman, and I am a second year medical student here at OSU. And I'm going to be telling you a little bit about the research that I did this summer. So, our research this summer looked at, we were evaluating spin in the abstracts of systematic reviews related to the treatment of psoriasis. So, a little bit about psoriasis: it is an inflammatory autoimmune skin condition that affects over 100 million people worldwide, and then about 8 million here in the US. So it's very prevalent, and it's important that providers really focus on high quality evidence in order to treat it. Another thing about psoriasis is that it can actually have a bit of a psychiatric component. If you think about having some sort of rash on your face, or that can be irritating to the skin, this can affect patients' quality of life. And so, thinking about the psychiatric component, it's really important that all the evidence that physicians use to treat it is high quality. So, we focused on spin in psoriasis treatment. So, Yavchits et al. Has defined spin previously as a specific way of reporting, intentional or not, to highlight the beneficial effect of the experimental treatment in terms of efficacy or safety that is greater than what is shown by the results. Basically, what it's saying in another way is spin's kind of the misrepresentation of results, even if it's unintentional, in such a way that it influences the reader. So, studies have demonstrated that when physicians actually reference research, they tend to read only the abstract of a study. And this makes sense given the time constraints that physicians have in their practice. So, really, we wanted to evaluate the presence of spin in abstracts of systematic reviews. So, for that reason, since this is really what practitioners are looking at. So our methods, we searched Medline and Embase databases, and we were initially given 3,200 articles that we screened. And these were screened in a duplicate and masked double-blinded fashion. So I worked with another student, and we read through these, and then we came to agreements on which ones should be included in our final data set. And these were based on, maybe the papers that we got weren't related to psoriasis, or they weren't in English, or they weren't systematic reviews, those sorts of things. So finally, we ended up with 173 articles. So our results, we found that 21.4% of the abstracts that we looked at contained at least one type of spin. So over here, you can see to the right in this table, you can see that there are 9 types of spin, and they're all related to the misrepresentation of results, just in different specified ways, specified by Yavchits previously. The most common type of spin that we found was type 6. So if you look over here to the right again, type 6 is selective reporting of or overemphasis on harm outcomes, or analysis favoring the safety of the experimental intervention. So basically, misrepresenting the safety profile of a drug or treatment for psoriasis. So again, the most common type was type 6 that we found. One example we found was in this study, Wu et al. They were looking at interleukin antagonists for treating psoriasis. And specifically, the abstract of this study indicated that all the antagonists they looked at had, in quote, an acceptable safety profile. However, when we read through the results section, the authors actually point out that there were serious safety concerns involving suicide with this drug. And actually, after using brodalumab, 4 of the patients died from suicide. So this really highlights how it's very important for authors to appropriately report any adverse outcomes in the abstract, given that practitioners prescribing this drug would be reading the abstract. So conclusion, evidence was present in many of these abstracts. Future research should investigate any reporting and search for ways to better reduce spin within the literature. So these are my references, and I thank you for your time.